Good evening, everyone, and thank you for joining us this evening. Many thanks to those who are organising this event for TVN2gether, and TVN2gether in particular for asking me to be a part of this event today. My name's Rachel. I'm a tissue viability clinical nurse specialist at Great Ormond Street Hospital for Children, and today I'm going to be talking about paediatric pressure ulcers. So pressure ulcer development is often viewed as quite uncommon in paediatric populations, and that's often given the presumed relative ease of being able to reposition and frequently move these patients, because they're often seen as smaller patients, so therefore a lot easier to move. However, we know with survival rates among critically and chronically ill premature neonates and children is increasing, and that's through technological advances. This often increases the risk of pressure ulcer formation for these chronically sick children. We know as well that patients with complex and long-term health needs often require permanent medical devices, and that can be tracheostomies, feeding tubes, non-invasive ventilation, for example, and all those pose a risk to their skin integrity. We also know that young skin, it looks and functions very differently to an adult skin. It's often seen as ideal skin, and its characteristics are frequently sought by adults. But the thing we need to remember is that children are not just little adults. Beyond that smooth and supple beauty, there's significant structural and functional differences in their skin. It means that we have to think about handling them differently and trying to help protect their skin, because the self-protection mechanisms that are prevalent in healthy adult skin, they're not developed. And as a result, babies and children, they need that special care to keep their skin healthy. During the first years of life, there's considerable differences and development in the skin and the subcutaneous fat, and that really warrants handling these patients differently and much more cautiously than you would an adult. And even though a baby's skin can feel very chubby and squeezable, we know it's actually a lot thinner than an adult's skin. Overall, a baby's skin is 1/5 of the thickness of an adult's skin. And we also know that premature neonates, they have a higher ratio of that skin surface to their weight, and they often have a decreased or completely absent subcutaneous fat development based on their gestational age. We can see in this diagram the difference between a baby and adult skin. So in an infant's skin, they have the same number of layers as an adult skin, but each layer is considerably thinner, and it's made up of much smaller cells. In a newborn, the epidermis doesn't attach as well to the dermis, and that leads to fewer microscopic seals between them, and those are called hemidesmosomes. And this means, unlike in adults, where the skin's tightly sealed together, a baby's epidermis is much easier to get past, and it means they have a higher absorption rate compared with an adult skin. And this higher absorption rate predisposes them to dry, flaky, and impaired skin barrier. And this, coupled with those fewer epidermal cells, it greatly reduces the skin's barrier function. We know that skin resilience builds through infancy. Some of the challenges we have with caring for patients in the paediatric setting when it comes to pressure ulcer prevention is that actually it's a branch of medicine that's caring not only for infants, so small neonates and children, but also adolescents as well. So you've got this vast range of size of patient, from perhaps, a couple of kilograms up to even bariatric patients. And it really poses challenges for clinicians who need to maintain clinical expertise in such a diversity of support surfaces and pressure ulcer prevention products to manage this vast range of patients. Historically, infants and children were placed on support surfaces specifically designed for adults, and we weren't really sure what their clinical efficacy would actually be on patients of smaller stature and lower weight. And because children are not little adults, they need to be placed on a pressure redistribution surface that's actually specifically designed for them, and specialist to their loading needs. What we are starting to see is a success in innovation in surface design, and that's starting to see specialist surfaces for neonates and paediatric mattresses with no minimum weight limit being designed. One of the greatest issues we have in pressure ulcers in regards to paediatric patients is medical device-related pressure ulcers. They're widely recognised as a massive risk factor for paediatric patients. And this often is due to the fact that medical devices are often designed with adults in mind, and they have to be adapted for paediatric use. And as we've said before, we have this vast size range of patients that we're actually trying to care for. And considering that they do occur under a plethora of medical devices, it's really imperative that we ensure that there's frequent and comprehensive skin inspections underneath those devices, and those devices are either removed or repositioned as frequently as possible. It's really important that we're helping those patients that are unable to communicate their discomfort to us by checking underneath those devices regularly so that we can see those early signs of skin damage. And it's a particular concern with active paediatric patients who are at risk of playing with devices. It can actually lead to clinicians securing those devices to the skin even harder to try and prevent dislodgement, and also that we need to be thinking about how we can use members of the MDT to help us with these devices. So getting in touch with OTs and physios and other specialist nursing teams that have expertise in these devices to see how we can perhaps apply an interface layer to prevent friction and shear, or offload some of it using a gel pad, perhaps, and how that can actually be incorporated into that patient's care when we're unable to remove that device. So our take-home messages tonight around paediatric pressure ulcers are that they do occur in the paediatric population. They can be severe, they can be life-limiting, and they can also cause permanent skin damage to our patients. With that wide variation in patient size, clinicians need to ensure they enhance their knowledge of all these different size surfaces and pressure ulcer prevention products that are available on the market. And we need to be pushing industry to look at the size variation of our patients when they're designing new medical equipment and devices so that they can have specific devices made for them. We also know research is really limited in this field, and more is needed to help support and guide our practice. Thank you very much.